Hi, good day. This is Jeremy Rod Cabañez. Welcome to CBRC, where the dream and the dreamer become one. And our topic for this day would be medical surgical nursing, and we'll be selecting four major topics. Okay, so we'll be discussing about neurosensory conditions. Second, we have the genitourinary disorders, musculoskeletal disorders, and last would be your cellular aberration, or we known as oncology. Alright, let's start with neurosensory conditions. Before we proceed, I'd like to review some of the most important concepts when we talk about the nervous system. So the nervous system is divided into two major divisions. So we have the central nervous system and we have the peripheral nervous system. So under the central nervous system is that we have the brain and the spinal cord. And I'll be focusing our attention to the brain. The brain, which is one of the most important part of the body, is usually divided into two major portions. So we have the right side and the left side of the brain, right? So before we will be understanding some of the conditions, let us try to understand the concepts of the right and the left part of the brain. We have to take note that the brain, or the two sides of the brain, controls the opposite side of the body. We know it as your contralateral side. So therefore, whenever there is an affectation on the right side of the brain, therefore it would be the left side of the body that would be affected. Okay, and vice versa. If the left side of the brain or the left hemisphere of the brain is affected, then we will have also an affectation on the right side of the body. So you have the right hemisphere and the left hemisphere. In addition, in the brain, we have what we call the different lobes with their functions. So as to review, we have the frontal lobe, which is the largest portion of the brain. The frontal lobe, which controls the motor function. When we talk about motor function, we are talking about movement. At the same time, it also controls it is the center of higher learning. So when we talk about the higher learning, we are talking about memory, judgment, and reasoning. And in addition to that, we have also the personality and behavior is also controlled by the frontal lobe. In addition, you have also the parietal lobe. The parietal lobe of the brain controls the sensory function. And you have also the temporal lobe, which controls the hearing, or what we call auditory functioning. And last but not the least, you have the occipital lobe of the brain, and that occipital lobe of the brain controls the vision. Aside from that are the functions of other parts of the brain, such as the thalamus and the hypothalamus. When we talk about the function of the thalamus, it is the sensory relay station of all senses. Sensory relay station. But we have an exemption. It is except the sense of smell. Yun lamang po ang hindi kasama. Sense of smell in the thalamus. So once again, the thalamus is the sensory relay station. How about the hypothalamus? The hypothalamus is responsible in the regulation of endocrinologic functioning. So we have what we call the fluid balance, temperature regulation, sleep-wake cycle, hunger and appetite control. You have also your emotions and impulsive sexual behavior. So most of the endocrinologic function is controlled by the hypothalamus together with the pituitary gland. Okay. Aside from that is the hindbrain. As we remember, the hindbrain, we have your brainstem, such as the brainstem has the pons and the medulla oblongata. The pons and medulla oblongata is very important in the regulation of internal organs. The brainstem, the pons, and medulla oblongata is specifically important in respiration. So that is why whenever there is an affectation of the brainstem, vital signs would be affected as well as the patient's respiration, because dun po natin matatagpuan ang pneumotaxic center and the respiratory center. Alright, so that is all about the brain. And you have also the spinal cord, which is your sensory and motor function. Okay? So to proceed, let's talk about the first disorder that we are going to relate. The first disorder is your CVA. Do you remember your CVA? CVA, which stands for what? It stands for cerebrovascular accident. Alright, so we know it as your CVA, CVD, or sometimes it is also known as your stroke. Cerebro means brain. Vascular, which means the blood vessels. Accident, meaning to say there is a dysfunction in the brain and in the blood vessels. Particularly, it is the artery that carries the oxygenated blood going to the brain. Now, you must remember that the brain needs 20% of oxygen, okay? So, it needs the 20% of oxygen that we breathe in, okay? So, therefore, when we talk about the brain needs oxygen for it to function, para siya ay makapag-function, such as to have memory, such as to have motor and sensory function. We need a good blood supply to the brain. So therefore, we need to remember that time is brain. Whenever there is anoxia to the brain or nakulangan ng blood supply, hypoxia of the brain, therefore, there could be an irreversible brain damage that may occur. Alright? So when we talk about your CVA, what is the major problem in stroke or cerebrovascular accident? The major problem that we need to remember is a deficiency of blood supply. So the major problem is a deficiency of blood supply. There is lack of blood supply to the brain. Now, what are the possible causes of your stroke or CVA? Now, we have two major causes, right? So we have first the ischemic stroke and the hemorrhagic stroke. So let us differentiate between the two. When we talk about the ischemic stroke, it accounts for 87% of cases, and the remainder is found on hemorrhagic stroke. Okay? So major cause ng stroke po natin is ischemic. What do we mean by ischemic? When we talk about ischemic, there is deficiency of blood supply caused by what? What are the two major causes? First, it could be caused by what? It could be caused by a thrombus. Okay? So, a blood clot. So, as you can see in here, as we are going to picture, these are the area in which there is an infarction or there is an ischemia that could be found on the brain. Why? Because there is a certain blood clot. Nandito po yung tinatawag nating blood clot. And that blood clot hinders the blood supply towards the area of the brain. So that is your ischemic stroke. It could be caused by a blood clot. Okay. So let's have your another slide. Okay. So we have here your coronal section of your brain. Now, as you can see, what are the causes of this clot? The clot could be caused by your atherosclerosis. What do we mean by atherosclerosis? There is a deposition of fat that could be found on the artery. So whenever there is a deposition of fat, specifically on the inner lining of the artery, which is called your tunica intima, nagkaroon siya ng fat accumulation, there are certain period of time wherein it may rupture. Once it ruptures, clot would be formed. Right. Now, when these clot are formed, this is the main reason kung bakit nakukulangan ng blood supply ang ating part of the brain. Alright? So, therefore, in this picture, nandito yung tinatawag po nating ating cerebral artery that carries the blood going to the brain. So therefore, kapag meron tayong problem in that cerebral artery, what would be the effect? The effect would be the dysfunction of the brain kung saan nawalan tayo ng blood supply. Alright? So that is what we call your thrombus formation as one of the causes of ischemic stroke. Okay. And usually, class, when we talk about your thrombus or ischemic stroke, it usually occurs in elderly, okay? So, yung thrombus formation usually occurs in elderly, and usually, ito po ay nangyayari during nighttime, right? So, the attack of your stroke or CVA for thrombus or blood clot as the cause would be during the nighttime. And the most common age group affected is your elderly. Alright, let's move forward. Okay, another one is your embolic stroke. A while ago, we have discussed about the thrombus formation. Now, how are we going to differentiate thrombus from your embolus? Okay, so this is an example of an embolic stroke. Alright, now, when we talk about your thrombus a while ago, that is the clot formation that could be found onto the brain. Saan siya nabuo? Nabuo yung blood clot mismo doon sa brain natin. But when we talk about an embolic stroke, it is defined as a dislodged blood clot. So, ibig sabihin, there is a blood clot that is from the other parts of the body. Say, for example, a deep vein thrombosis na nag-travel going to the brain. That is what we call now your embolus. So, again, an embolus is a dislodged clot. And usually, it affects young adults, okay? And usually, it occurs upon awakening or during waking hours. So, magkabaliktad po ang ating thrombotic and ang ating embolic. So, once again, when we talk about thrombus formation, most commonly on elderly during sleep or during nighttime. When we talk about an embolus or a dislodged clot, it occurs on young adult and also it occurs during waking hours. Alright? So, that is the difference. And they are what we call ischemic stroke. So, once again, ischemic stroke, the problem is the blood clot, and it accounts for 87% of cases. Alright, now let us try to describe your hemorrhagic stroke. Okay, when we talk about your hemorrhagic stroke, okay, your hemorrhagic stroke, the main cause of your hemorrhagic stroke is what? Ano po ang pinaka-main cause ng hemorrhagic stroke? The main cause of hemorrhagic stroke is a chronic hypertension. Let's go back with the causes. Okay. Alright. So when we talk about your hemorrhagic stroke, pag sinabi natin hemorrhagic stroke, there is bleeding. So one of the example of your hemorrhagic stroke is a ruptured aneurysm. And one of the primary cause is untreated and chronic hypertension. Ano ba nangyayari pag merong hypertension? Mataas ang blood pressure. So pag mataas ang blood pressure, it causes weakening of the arteries, and that weakness of the arteries causing them to have a rupture. So kung makikita natin, nandito yung hemorrhage natin. And usually it accounts for your 13% of cases, and this is more life-threatening than your ischemic stroke. Why? Because in the presence of bleeding, in the presence of hemorrhage, pwedeng magkaroon tayo ng increased in intracranial pressure. Do you remember your increased intracranial pressure? Pag sinabi nating intracranial pressure, the normal value is 10 to 20 mmHg or 10 to 20 millimeter mercury. So therefore, in the presence of blood clot, in the presence of bleeding, may problem tayo within the cranial vault. What would happen to the ICP? It will increase, and an increase in ICP could be life-threatening. Why? Because it usually affects the brain functioning. So as a whole, pwede tayong magkaroon ng brain dysfunction. Alright? So yan po yung tinatawag po nating causations. So the causations natin, it could be ischemic or hemorrhagic, and when we talk about hemorrhagic, the main cause is your chronic hypertension. Alright, now let us classify the different types of stroke. Okay, so classifications. We have three major classifications of CVA or stroke. First, let's talk about transient ischemic attack, TIA. Ano ba yung tinatawag po nating TIA? Pag sinabi nating transient ischemic attack, this is a temporary loss of blood supply to the brain. Yun ang ating pinaka-problem, ha? Take note of the keyword, temporary loss of blood supply to the brain. So therefore, when we talk about TIA, this is usually a reversible type of stroke. Okay? So pag sinabi nating reversible, pwede siyang bumalik pa yung kanyang functioning. Now, ang ating keyword dito would be the time span. Okay? At ano ang time span natin? Pag sinabi nating transient ischemic attack, the usual time span of its reversal of the blood supply is usually within 24 hours. Some of the other references says 12 to 24 hours. So usually this is reversible. Meron lamang tayong tinatawag na slight neurologic dysfunction, but it is reversible. Pwedeng bumalik ulit siya sa kanyang normal functioning. Okay? So that is what we call your TIA. Let's talk about now the second classification. The second classification of your stroke is known as your progressive or in other references, they say it is a stroke in evolution. Ano naman ang ibig sabihin? Pag sinabi naman natin progressive or stroke in evolution, from the word progressive, dahan-dahan. Evolution, ibig sabihin, nagsimula tayo from a very small amount of deficit that worsens in a day or two. So therefore, the patient has a slight neurologic deficit. Okay? So possible tayo na meron tayong konting dysfunction and after a day or two, it worsens. Ito yung tinatawag natin na occurrence of mild stroke followed by another episodes of mild stroke in a day or two. Ibig sabihin, for example, ngayon, nagkaroon ng mild stroke ang pasyente, kinabukasan makalawa another mild stroke until such time that the patient will have the total neurologic deficit. So that is your number 2. Ang tawag na ulit natin, progressive or stroke in evolution. Alright, let's talk about the third classification. And the third classification of your stroke is what we call your complete stroke. Okay, so ano naman ang ibig sabihin ng complete stroke? Pag sinabi natin complete stroke, at that point in time na nakulangan ng blood supply ang brain, therefore, you have what we call a total neurologic deficit. Anong ibig sabihin ng total neurologic deficit? Immediately, the patient's disability could be observed. Okay, doon na natin makikita ang major manifestations of your stroke. So therefore, let us review the 3 classification. First, you have your TIA. It is a reversible type of stroke. And when we talk about your TIA, sabi natin, it could be reversed within 24 hours. Second, you have your progressive or stroke in evolution. Anong nangyayari dito? There is slight neurologic deficit that worsens in a day or two. And last but not the least is the complete stroke wherein there is presence of total neurologic deficit. Alright, so as we are going to check the picture, ito po yung nangyayari sa stroke and evolution and a complete stroke. Next slide please. Yes, so this is your stroke in evolution. Nagkakaroon muna tayo ng early thrombus formation. So nandito yung ating thrombus. Alright? So early, there is first a slight, okay, thrombus that is appearing until such time na magkaroon na tayo ng occlusion of the vascular system until such time that occlusion may cause now an ischemia to the different parts of the brain. So that is what we call your stroke in evolution. Okay, however, pag complete stroke yan, immediately nagkakaroon na tayo agad ng ischemia or nagkakaroon tayo ng affectation or deficit on that specific part of the brain. Alright? So those are the 3 classifications of stroke. Okay, next slide please. Now, let us take into consideration the pathophysiologic mechanism that is occurring before we proceed with your manifestations. Now, it is very important to take note. Sabi natin, the time is brain. So therefore, the major problem here in stroke is the interruption of blood supply. Alright? So anong problem natin? Kauna-unahan, nagkakaroon tayo ng loss of blood supply to the brain. So kapag nakulangan ng brain, ano mangyayari? Ano bang dinadala ng blood? The blood carries important nutrients. It carries specifically oxygen. Sabi nga natin kanina, oxygen is the most important component so that there would be a metabolism of all tissues in the body, and included sa tissue na yan is your brain tissue. So nakulangan ng oxygen. At the same time, the blood carries glucose. Pag sinabi natin glucose, sugar. And you must remember, glucose is the food for the brain. So therefore, in the absence of our oxygen and glucose into the brain, what will accumulate in return? In return, pag bumababa ang oxygen at glucose, okay, you have your inversely proportional relationship niya are the waste products. So, ano naman yung mga waste products na tumataas? Those are the metabolic waste such as carbon dioxide. And you must remember, class, pag pinag-usapan natin ang carbon dioxide, kabaliktaran yan ng oxygen. Usual na effect ng carbon dioxide is vasodilation. So, anong mangyayari? Pag nagkaroon ng vasodilation, mas lalong makukulangan ng blood supply ang brain. At the same time, magkakaroon ng accumulation of lactic acid caused from your anaerobic metabolism. What do you mean by anaerobic metabolism? In the absence of oxygen. These are waste products. Pag sinabing waste products, hindi kailangan ng katawan. So that is why, kapag yung mga yun ang nag-accumulate, there would be death of cerebral tissue. Okay, and what will happen? Ang ating disabilities would be dependent upon the area of the brain that is involved. Diniscuss natin kanina, di ba? So kung ang ating area right or left hemisphere would be the problem, then magkakaroon tayo ng opposite side affectation or contralateral affectation. If the frontal lobe is affected, then memory functioning would be impaired, and also your higher mental learning would also be impaired. Kapag brainstem ang naging problem, therefore respiration and vital signs would be the problem. So it depends upon the area of the stroke. Now, there are two major parts or hemisphere of the brain. I-review ulit natin yon. Balikan po natin ang hemisphere. Next slide please. Alright, now, the right side and the left side. Natandaan, aside from their motor functioning, we have discussed that the right side controls the left side of the body, right? The left side controls the right side, and vice versa. The right hemisphere of the brain controls the left side. In addition, nandito pa po yung kanilang mga function. Let's take it one by one. On the left side, nandyan yung tinatawag nating spoken language. Okay, pag sinabi kong spoken language, it is what we call your motor speech. Do you remember your motor speech? The motor speech is located on the left hemisphere of the brain, and it is also known as your Broca's area. Madaling tandaan, Broca, buka. Pag bumukang bibig, that is a motor functioning. Okay, so the motor speech is found on the left hemisphere. Okay, what else? Reasoning. Okay, written language, and number skills. So, nandito yung higher mental learning. So, speech, and also reasoning and other skills. Alright, how about on the right side of the brain? Aside from it controls the left side of the body, it is also the center of creativity, center of music. What else? Spatial orientation, awareness of the space or awareness of your body in a certain area. And also, artistic works are also found on the right side of the brain. Thus, when we have your stroke dependent upon the side, we will have the following clinical manifestations. Alright? Can we proceed with the clinical manifestations? So, you have the left stroke and the right stroke. Okay, for the left stroke. Okay. Sabi natin, ano ang mga function ng ating left side? The left side, doon natin matatagpuan ang function ng opposite side of the body. So therefore, anong mangyayari? Magkakaroon tayo ng tinatawag nating weakness and paralysis of what side of the body? Of course, that would be the right side of the body. Now, what do you call that weakness or paralysis? Pag sinabi nating weakness of the half or the lateral half of the body, tatawagin po natin iyon na hemiparesis. Alright? So once again, weakness of the lateral half of the body is hemiparesis. How about your paralysis? When we talk about the paralysis, ang tatawagin po natin yang hemiplegia. So hemiplegia is the paralysis of the lateral half of the body. So therefore, in left CVA or left hemisphere stroke, nagkakaroon po tayo ng tinatawag nating right hemiparesis, right hemiplegia. Alright, what else aside from that? Your sensory functioning will also be impaired. Diba? Sensory functioning natin would be impaired. Okay, such as your vision. Okay? So, tandaan din po natin that the control of your vision could also be on the opposite side. So, pag sinabi nating opposite side, ito yung tinatawag nating contralateral. So, therefore, sa left CBA pa rin, anong tatawag natin? Pag half of the visual field has deficit, tatawagin na po nating hemianopsia. So, whenever you have a visual deficit of the half of the visual field, tatawagin na nating hemianopsia. So, for your left CBA, anong part ng eye ang ating affected? You will have your right hemianopsia, and vice versa with the right. In addition, kasi nga ang left side, nandyan yung ating tinatawag na mental skills and motor skills, such as your speech. So therefore, the patient will have your dysarthria and you will also have your aphasia. Anong pagkakaiba ng dysarthria sa aphasia? Pag sinabi nating dysarthria is the difficulty in initiating speech. Okay? Pag sinabi nating initiating speech, nahirapan siyang magsalita or the patient will have a slurred speech. Slurring of speech would be common. How about now your aphasia? Pag sinabi naman po nating aphasia, that is what we call your absence of speech. Now, if the left side of the brain or the left hemisphere is affected, what type of aphasia could be noticed to the patient? So, ang tinatawag natin, motor speech ang problema natin. So, usually, that would be your expressive aphasia. Maliwanag tayo dyan, ha? So, pag ang problem natin is left stroke, you will have your expressive aphasia. What do you mean by expressive aphasia? That would be difficulty in speaking, okay? Difficulty in writing words. However, the patient's comprehension and understanding would not be impaired, all right? So that is what we call your aphasia and dysarthria. All right. What else? Aside from that, you will also have your right hemisphere stroke. Okay, so right side naman tayo. So sa right side naman natin, you have noticed, sabi po natin, na ang ating affectation is always on the opposite side or the contralateral of the body. So therefore, if the right hemisphere of the brain is involved, usually it would be the left side of the body that would have your deficit. So again, you will have also, again, your weakness and paralysis. Ano nga yung tinatawag nating weakness? Tawag natin hemiparesis. How about paralysis? Hemiplegia. So ulitin ko, kapag right hemisphere stroke, you will now have your left hemiparesis and left hemiplegia. Ano naman ang sensory problem natin? Left hemianopsia. So, ibig sabihin, there would be again loss of the half of the visual field. In addition, di ba sabi po natin, yung ating spatial awareness, okay? Or spatial orientation is also found on the right hemisphere of the brain. So, therefore, ano po ang mangyayari? You will have your this awareness or nawawalan lack of awareness of the patient's spatial orientation, and of course, the artistic skills of the patient, music skills of the patient will also be lost. Alright, so that is the difference of the patient's manifestation when we talk about stroke. Now, we have other manifestation. Next slide, please. Alright, so we have the other manifestation. We have the manifestations also of increased ICP. Diba? Diniscuss natin kanina, kapag may hemorrhagic stroke, immediately increased ICP would occur. What are some of the manifestations of increased ICP? Increased ICP such as headache. Diba? Possible din ang fever. What else? Loss of consciousness may also occur. Diba? Confusion. Okay? And also, dependent upon the area of the brain to be involved. Now, in addition to that, the patient will also have dysphagia. Now, what do you mean by dysphagia? Pag pinag-usapan natin ng dysphagia, kasi affected din ang muscles ng tongue, muscles ng throat, and muscles ng face. So, therefore, dysphagia will occur. And that is what we call your difficulty in swallowing. Now, what would be the nursing diagnosis kapag may difficulty of swallowing? And that would be our priority. That would be your risk for aspiration or risk for ineffective airway clearance. So, yun yung problem natin. So, that is why feeding could be difficult for a patient with stroke. Okay, what else? Other manifestation, patient may also have bowel and bladder dysfunction, diba? And also, the patient will also manifest sexual dysfunction. So, iba't iba, nagkakaroon na tayo ng ating syndromes or a system or a holistic na nagkakaroon na tayo ng mga problems from head to toe. Alright? So aside from manifestations of stroke, manifestations of increased ICP would also occur. Alright? So they are what we call your clinical manifestation. Now, let us diagnose. So, paano naman natin na-diagnose ang ating stroke? Now, we have several diagnostic tests. Alright? First, in the diagnostic test, blood test muna tayo, ano? So, we will have your CBC, okay? What do you mean by CBC? CBC stands for complete blood count. Dahil may injury sa brain, usually the WBCs are increasing. And when we talk about if the WBCs are increasing, we call it as your leukocytosis, alright? In addition, kapag meron tayong ischemic stroke that is caused by atherosclerotic plaque, okay? Alright? ang ating tinatawag na atherosclerotic plaque or fat accumulation, kailangan nating tingnan yung tinatawag nating total cholesterol. Alright? So, titingnan natin yung ating lipid profile. Pag sinabi nating total cholesterol, tumataas sila together with the triglyceride. Now, naalala po ba ang normal value? Normal value, pag sinabi po nating total cholesterol is less than 200 mg per dl. Pag sinabi nating triglyceride, the normal is 100 to 200 mg per dl. How about the ratio of HDL and LDL? Anong pagkakaiba nila? Kasama din po sa lipid profile si HDL at LDL. LDL stands for low density lipoprotein. Ano yung low density? That is your bad cholesterol. How about HDL? High density lipoprotein. That is your good cholesterol. Tandaan, high density lipoprotein, letter H, heaven. So good cholesterol normally should be higher than the bad cholesterol. Now, what is the normal value? Normal value ng ating low density lipoprotein is less than 160 mg per dl. How about your high density lipoprotein? The range is 35 to 85 mg per dl. Again, normally, kailangan mas mataas ang HDL sa LDL. Pero sa pasyente na may possible ischemic stroke, mas tumataas ang ating LDL or bad cholesterol. Alright. In addition, we could also have your other diagnostic tests such as your CT scan. What do you mean by CT scan? It stands for computed tomography scan. In computed tomography scan, it would be of different than your X-ray. Naalalang X-ray, di ba? We only detect or we only obtain a single image. Pero pag sinabi na natin itong CT scan will obtain cross-sectional view of images or slices of images. Why? Because we use a narrowed X-ray beam. Alright? So when we talk about a narrowed X-ray beam, we detect as slices of images so that we would be able to determine the area of the hemorrhage, the area of clot formation, or the area of the stroke. Alright? So CT scan is very helpful to detect which part or which area of the brain that is involved. Alright, in addition, another diagnostic test, cerebral angiography. What do you mean by angiography? In angiography, we have the injection of a contrast medium, and after the injection of a contrast medium, radiography would be performed so that to visualize the location or the areas of clot or infarction. Alright? So therefore, what is the most important intervention, most important preparation before undergoing our cerebral angiography, and that is to assess allergies against iodine. Why do we need to assess allergies for iodine? Because the contrast medium is iodine-based. Okay? So therefore, history taking should inquire about allergies not only to iodine, but it is related to your seafoods or shellfishes. Kasi airway ang pinag-uusapan natin. Kapag hindi natin na-detect yan, then bronchospasm during the procedure may be the effect. So that could be life-threatening for the patient. So again, diagnostic test, kasama dyan ang CBC, lipid profile, sinasama din natin ang CT scan and your cerebral angiography. Alright, now let's talk about the important medical management. Okay, what are the medication? First and foremost, pinakamahalaga, we need to have your supplemental oxygen. Alright? So, oxygen. Bakit mahalaga? Kasi di ba sabi natin, bumababa ang oxygen. Kapag bumababa ang oxygen, tumataas si carbon dioxide. Ano nga ulit ang effect ni carbon dioxide? It is vasodilation. So therefore, pag binigyan natin ng oxygen, ano mangyayari? Vasoconstriction. And that vasoconstriction will what? Will reverse the loss of blood supply. Alright? In addition, class, you have also your intubation. Some of the patients may have affectation of the respiration. Why? Because of an increase in ICP. In addition to increased ICP, the brainstem may also be involved. So therefore, some of the patient may need intubation immediately, especially kapag bumabagsak ang kanilang oxygen saturation. Another therapy, you have your thrombolytic therapy. Alright, what are the best example of your thrombolytics? Okay, you have your example streptokinase, urokinase, retaplase, ateplase, and you also have your TPA. Nandyan po yan. Pag sinabi nating TPA, tissue plasminogen activator. Alright? So, anong ginagawa po ng thrombolytics? Thrombo means clot. Lytics means dissolve. So therefore, it is used to dissolve the clot. However, please remember that thrombolytics should not be given or is contraindicated to a patient with bleeding tendencies. Example na may mga bleeding tendencies are your hematologic and coagulation problems such as your hemophilia. So bawal po nating ibigay yon. Alright. In addition, tandaan that this thrombolytic therapy may cause bleeding. So that is why we need to monitor for signs and symptoms of bleeding such as vital signs changes, hypotension, tachycardia, and tachypnea. Alright. What else? Aside from that, tandaan, binibigay lamang po ang thrombolytic therapy in a recent occurrence of stroke. What do you mean by recent occurrence of stroke? Ibig sabihin, within 3 hours of the occurrence of stroke. Kapag medyo matagal na yung stroke, say for example, after 48 hours, or after ilang days na, hindi na magiging effective si thrombolytics. So that is why other medications will be provided. Alright, let's move forward to other medical management. Anticoagulants. Alright, now, we have two types of anticoagulants. We have what we call your heparin and warfarin. Alright, so anong pagkakaiba po nila? Pareho silang anticoagulant, but heparin is parenteral, okay, by injection. Pag sinabi nating warfarin, this is given orally. Alright. So, yun ang pagkakaiba. Heparin, parenteral, warfarin, oral. Alright. Now, when you are going to give anticoagulants, be sure to know its action. And the action is, it prevents coagulation. So, ibig sabihin, iniiwasan niya yung further thrombus formation. Now, what is important here is you have to monitor your coagulation time. Okay? Ito yung tinatawag nating clotting time. So, for heparin, okay, we monitor PTT, partial thromboplastin time. Pag warfarin therapy, we monitor PT. What do you mean by PT? Prothrombin time. Or, tinatawag din natin sa ibang references, INR. Anong ibig sabihin ng INR? International Normalized Ratio. So, normally class, kapag nag-a-anti-coagulant ang pasyente, it would be prolonged. Okay? Or, twice the value of a normal finding. So, say for example, ang normal PTT natin is 15 to 30 seconds. So, pag nag-heparin therapy siya, possibly magiging 30 to 60 seconds. Okay, so that is why you have also to monitor for manifestations of bleeding. Okay, so bleeding may also occur. So that is why antidote for its toxicity should be at bedside. Alright, now, pag tinanong kayo ano ang antidote for heparin toxicity, dapat tandaan, it is your protamine sulfate. How about for warfarin toxicity? It would be your vitamin K. Alright, so that is all about your anticoagulant. Next, you have also your platelet inhibitors. Okay, platelet inhibitors, the best example would be your aspirin, acetyl salicylic acid, or your clopidogrel Plavix. Ano naman ang ginagawa niya? From the word platelet, ano ba ang function ng platelet? It is for coagulation. So therefore, it prevents platelet agglutination, hence they are blood thinners. Bakit kailangan maging manipis or malabnaw yung dugo? Para hindi magkaroon ng damage sa blood vessels to prevent further thrombus formation. But take note about the side effect of prolonged use of your platelet inhibitors such as aspirin. Aspirin may cause bleeding. At the same time, chronic use of aspirin may lead to ototoxicity or hearing loss. Alright? So, yun po yung ating platelet inhibitors. Next, management. You also have your antihypertensive. Do you remember the cause of your hemorrhagic stroke? The major cause is your chronic hypertension. So, there would be variety of antihypertensives to be given. Alright? Such as calcium channel blockers, beta blockers, ACE inhibitors, central alpha antagonist, and so forth and so on. Okay? So, maraming iba't ibang klaseng antihypertensives. Ano lamang ang i-monitor natin when the client is taking antihypertensive? If the patient is to be given an IV antihypertensive, you need to use infusion pump. Okay? Kapag naman tayo ay nagbibigay ng antihypertensive, you need also to monitor the blood pressure. And be sure na ang ating blood pressure is on a normal range. Kasi pag bumagsak ang blood pressure as its side effect, orthostatic hypotension can lead to dizziness that may lead to risk for injury. Alright? So that is why you have to monitor the BP closely for the response of your antihypertensives. Alright? And of course, we need to give medications for increased ICP. Okay, ano ba yung mga medications pag tumatas ang ICP? So whenever there is brain inflammation caused by injury, we need to give your, say for example, diuretic, mannitol, di ba? You need also to give corticosteroids. Kapag meron tayong fever, antipyretic. Kapag meron kang headache that cannot be controlled, opioid. But be sure, dahil yan ay brain condition, we do not give opioid analgesic kasi central nervous system depressant. So, pwedeng magbigay ng safe analgesic. Example of a safe analgesic would be your acetaminophen or your Tylenol. Alright? So, kung meron naman tayong seizure, anticonvulsants could be provided to the patient. So, we treat if there is manifestations of increased ICP. Alright? So, they are what we call the medical management for CVA or stroke. Alright, let's proceed with the nursing management. Okay, what are the nursing care? So, emergency care natin would be the care for a patient with increased ICP. Do you remember the care for a patient with increased ICP? What are those? Proper positioning. Ano nga ba yung position natin pag may increased ICP? Okay, that would be your semi-Fowler's position. We elevate the head of bed 30 to 45 degrees. Hindi pwedeng lumagpas sa 30 to 45 degrees, kalalong tataas yung kanyang ICP. Kailangan the head should be higher than the body. Alright? So you have your elevation of the head of bed or semi-Fowler's position. How about the position of the head and the neck? Tandaan, the head and the neck should be on neutral or midline position. Alright? So that is the positioning of the patient.